Malaria is caused by Plasmodium parasites transmitted through the bite of infected Anopheles mosquitoes. After entering the bloodstream, parasites travel to the liver, multiply, then re-enter the blood and infect red blood cells. This cyclical invasion produces fever, chills, sweating, severe fatigue, headache, anemia, and, in the most dangerous species, organ failure. Soldiers in the Pacific, Southeast Asia, Burma, New Guinea, and parts of North Africa faced continuous exposure due to standing water, dense vegetation, and night activity when Anopheles mosquitoes were most active. Infection rates could exceed battle casualty rates, removing entire units from operations for days to months. Suppression relied on drugs like quinine, atabrine, or chloroquine, protective clothing, nets, and mosquito control measures, but compliance was inconsistent because drugs caused side effects such as yellow skin discoloration and gastrointestinal discomfort. Without treatment, Plasmodium falciparum malaria could rapidly progress to cerebral involvement, kidney failure, or death. Plasmodium vivax triggered repeated relapses because dormant liver stages reactivated weeks to months later. Dysentery is an intestinal infection that causes diarrhea with blood or mucus, abdominal cramping, fever, and dehydration. Two major forms affected soldiers: bacterial dysentery, commonly due to Shigella species, and amoebic dysentery caused by Entamoeba histolytica. Both spread through the fecal-oral route, often from contaminated water, unwashed hands, improperly handled food, or flies, transferring waste to rations. In field conditions, makeshift latrines, crowded encampments, and limited clean water created continuous exposure. Shigella typically produces acute high-volume diarrhea and intense abdominal pain. Entamoeba infections may be slower, but can cause liver abscesses if parasites move beyond the intestine. Severe fluid loss led to weakness, impaired alertness, and increased risk of collapse during marches. Typhus is a lice-borne infection caused by Rickettsia prowazekii. Body lice become infected when feeding on infected blood. The bacteria multiply in the louse's gut and are shed in its feces. When a soldier scratches a louse bite, contaminated feces enter broken skin and transmit the pathogen. Symptoms begin with abrupt high fever, severe headache, muscle pain, and chills. Within days, a pink to red spotted rash spreads from the trunk to limbs. As infection progresses, blood vessels become inflamed, leading to low blood pressure, confusion, stupor, and organ failure. Trench foot is a non-freezing injury caused by prolonged exposure to cold, wet conditions that impair blood flow to the feet. Moisture softens tissue and constricts blood vessels, reducing circulation and starving tissue of oxygen. Numbness, swelling, and skin maceration develop first, followed by blisters and open sores that admit bacteria. Secondary infection can lead to cellulitis, gangrene, or systemic illness requiring amputation. Typhoid fever is a bacterial infection caused by Salmonella typhi. It spreads through contaminated water and food. After ingestion, the bacteria penetrate the intestine and enter the bloodstream, seeding organs such as the liver, spleen, and bone marrow. Symptoms include sustained fever, headache, abdominal pain, loss of appetite, and sometimes a faint rash. Intestinal ulcers can produce bleeding or perforation, causing peritonitis and rapid death. Dengue fever is a mosquito-borne viral disease transmitted primarily by Aedes mosquitoes. The virus infects immune cells, releasing chemicals that cause high fever, severe headache, muscle pain, joint pain, and pain behind the eyes. A rash may appear, and some cases develop bleeding. Severe dengue results from plasma leaking from damaged blood vessels, leading to shock and organ failure. Scrub typhus is caused by Orientia tsutsugamushi, transmitted through larval mites called chiggers. After entering the skin, the pathogen spreads, causing high fever, severe headache, muscle aches, and sometimes confusion. A dark scab-like lesion called an eschar forms at the bite site. A widespread rash can follow. Leptospirosis is caused by leptospirobacteria shed in the urine of infected rodents. Bacteria enter the body through cuts or mucous membranes when soldiers waded through contaminated water or mud. Early symptoms include fever, chills, muscle pain, and headache. Some cases progress to Weil's disease, with jaundice, kidney failure, and bleeding. Tuberculosis spreads through airborne droplets. After inhalation, Mycobacterium tuberculosis settles in the lungs, causing chronic cough, chest pain, fever, weight loss, fatigue, and sometimes coughing blood. Influenza spread rapidly in camps and transports. It caused sudden fever, cough, sore throat, muscle pain, and fatigue. Many recovered quickly, but secondary bacterial pneumonia caused many deaths. Pneumonia is infection of the lungs that fills air sacs with fluid and pus. Symptoms include cough with sputum, chest pain, fever, and rapid breathing. Meningococcal meningitis is caused by Neisseria meningitidis. The bacteria enter the bloodstream, cross into tissues surrounding the brain, and cause sudden fever, stiff neck, headache, vomiting, and light sensitivity. Hepatitis A spreads through contaminated water or food. The virus inflames the liver, producing fatigue, nausea, abdominal pain, dark urine, pale stools, and jaundice. Cholera is caused by Vibrio cholerae, acquired through contaminated water. The bacteria release a toxin that forces the intestines to secrete large volumes of fluid, resulting in rapid watery diarrhea, vomiting, dehydration, and electrolyte loss. Relapsing fever is caused by Borrelia bacteria transmitted by lice. It produces episodes of sudden fever, chills, headache, and muscle pain that resolve, then reappear as the bacteria evade immunity. Sandfly fever is a viral infection transmitted by sandflies in Mediterranean and Middle Eastern theaters. It caused abrupt fever, headache, muscle pain, and eye pain. Schistosomiasis is caused by parasites released by freshwater snails. Larvae penetrate the skin when soldiers wade through contaminated water. Adult worms live in blood vessels, producing fever, abdominal pain, diarrhea, and blood in stool or urine. Yaws is caused by Treponema pallidum pertinue. It spreads through direct contact with skin lesions in humid tropics. Tetanus is caused by Clostridium tetani spores entering wounds. The bacteria release a neurotoxin that blocks inhibitory nerve signals, causing sustained muscle contraction. Diphtheria is caused by Corynebacterium diphtheria. The bacteria produce a toxin that forms a thick membrane in the throat, obstructing breathing. Syphilis and gonorrhea spread through sexual contact. Syphilis begins with a painless sore, then rash and fever. Untreated, it damages the heart and brain. Gonorrhea produces painful urination and genital discharge. Fungal infections thrived in warm, wet environments. Ringworm caused circular rashes and itching. Athlete's foot produced cracked skin, allowing secondary infection. Tropical ulcers developed when minor skin breaks became infected in hot, humid regions. Filariasis is caused by worms transmitted by mosquitoes. They mature in lymph vessels, blocking flow and causing swelling. Parasitic intestinal worms spread through contaminated soil or food. They caused abdominal pain, diarrhea, and iron deficiency anemia. Scabies is caused by mites that burrow into skin, producing intense itching and rash. Impetigo is a bacterial skin infection producing sores with yellow crusts. Bartonellosis, trench fever, spread by body lice, caused recurrent fever, headache, leg pain, and weakness. Polio infected nervous tissue, causing muscle weakness or paralysis. Measles spread rapidly in crowded camps. It caused fever, cough, rash, and complications such as pneumonia. Mumps caused swelling of the salivary glands, fever, and weakness. Scarlet fever caused sore throat, fever, and red rash. Beriberi from thiamine deficiency damaged nerves in the heart. Pellagra from niacin deficiency caused rash, diarrhea, and mental changes. Scurvy from lack of vitamin C caused gum bleeding and poor wound healing. Food poisoning occurred when soldiers ate food contaminated with toxins. Symptoms included nausea, vomiting, cramps, and diarrhea. Wound infections occurred when bacteria entered injuries. Anaerobic bacteria could cause gangrene. Histoplasmosis occurred when fungal spores in soil were inhaled, causing fever, cough, and fatigue. Tick-borne encephalitis caused fever, vomiting, and neurological problems, including paralysis. Plague, spread by fleas from rodents, caused fever, swollen lymph nodes, and bloodstream infection. Brucellosis spread through unpasteurized dairy or animal contact, causing recurring fever and joint pain. Q fever spread through inhalation of barnyard dust, causing fever, headache, and pneumonia-like illness. Yellow fever caused fever, jaundice, bleeding, and shock due to liver damage. Paratyphoid fever produced prolonged fever, abdominal pain, and diarrhea. Glanders spread from horses or mules, causing fever, skin lesions, and pneumonia. Anthrax spread through spores, causing skin lesions or severe pneumonia. Rubella produced rash and mild fever, but infection during pregnancy caused birth defects among civilians. Tinea infections in the groin caused itching and discomfort. Giardiasis caused prolonged diarrhea, malabsorption, and weight loss. Conjunctivitis spread through dust, sweat, and contact, causing redness, discharge, and irritation.